I need to tell you something that could literally save your life starting tomorrow morning. Those 3 drinks I'm about to show you, they're not magic potions. They're not expensive supplements. They're research-backed, doctor-recommended beverages that have been studied in major universities and medical centers around the world. And the science behind them is so solid that some cardiologists are now recommending them alongside medications. I'm Dr. Sandra Whitmore, and I've been a cardiologist for 23 years, and I've watched the research on these drinks evolve from interesting observations to solid clinical evidence. But here's what almost no one talks about. These drinks work through specific biological mechanisms. They're not just healthy in a vague, general way. They target the exact pathways that control blood pressure. And when you understand how they work, you'll realize why timing matters, why preparation matters, and why drink number 1 is so powerful that it can start working within 2 to 3 hours. By the end of this video, you'll know exactly what those 3 drinks are. But more importantly, you'll understand the science behind why they work, how much you need, when to drink them, and how to prepare them for maximum benefit. And if you're already on blood pressure medication, I'll tell you exactly how to safely incorporate these drinks into your routine. But before I can show you drink number 3, the one that surprised even me with its consistency across multiple studies, I want to ask you to do something important. Subscribe to this channel right now. My mission is to give you evidence-based information that empowers you to take control of your health. Information that's usually locked behind medical journals and research papers. I'm bringing it to you in a way that's clear, practical, and actionable. Hit that subscribe button because what you're about to learn could be the most valuable 20 minutes you spend this week. Let me start by telling you about Frank, because his story is going to show you why drink number 3 matters so much, and why the timing of when you drink it could be the difference between it working and it doing nothing at all. Frank was 71, a retired postal worker, healthy overall but struggling with borderline high blood pressure. His readings were hovering around 138/88. Not terrible, but not good. His doctor wanted to start medication, but Frank wanted to try natural approaches first. He'd heard that green tea was good for blood pressure, so he started drinking it. 3 cups a day, every day, for 6 weeks. His blood pressure didn't budge. 138/88. Same numbers. He was frustrated, convinced that all this natural remedy stuff was nonsense. He was ready to start the medication. But here's what Frank didn't know. And this is critical. He was drinking his green tea wrong. Not the tea itself, that was fine. But he was drinking it mid-morning, mid-afternoon, and evening, random times. Sometimes with food, sometimes without. Sometimes he'd steep it for 2 minutes, sometimes for 5 minutes. No consistency, no strategy. When Frank came to me for a second opinion, I explained something that changed everything. The compounds in green tea that lower blood pressure, specifically catechins, and a compound called EGCG. They need to be consumed in a specific way to maximize their effectiveness. And the research shows that morning consumption, on a relatively empty stomach, before your blood pressure naturally peaks during the day, that's when you get the strongest effect. We changed Frank's protocol. 1 cup of green tea, first thing in the morning, steeped for exactly 3 minutes in water that was hot but not boiling, about 175 degrees Celsius. Consumed 30 minutes before breakfast, every single day, consistent. 3 weeks later, his blood pressure was 128/82, 10 points down on the systolic, 6 points down on the diastolic. No medication, just 1 properly prepared cup of green tea at the right time. But here's what Frank's story teaches us. And this is the foundation for everything I'm about to tell you. These drinks work, but they only work if you use them correctly. The wrong timing, wrong preparation, or wrong dose, and you get nothing. You end up like Frank was, frustrated, thinking it doesn't work, when really it's just a matter of understanding the science. So let me reveal drink number 3. Green tea. Specifically, traditional green tea, not green tea extract, not green tea supplements, not matcha, although matcha has benefits too. I'm talking about regular, high-quality green tea leaves or bags, properly prepared and consumed at the right time. Now, you might be thinking, that's it? Green tea? Everyone knows green tea is healthy. But let me show you what the research actually says, because it's far more impressive than most people realize. A systematic review published in 2023 analyzed data from multiple clinical trials involving thousands of participants. The conclusion was clear. Daily green tea consumption reduced systolic blood pressure by an average of 2.99 millimeters of mercury and diastolic pressure by 0.95 millimeters. Those numbers might sound small, but remember, a reduction of just 2 millimeters in systolic pressure across a population translates to a 6% reduction in stroke risk and a 4% reduction in coronary heart disease risk. But here's where it gets really interesting. The studies that showed the strongest effects were the ones where participants consumed 5 to 6 cups daily. Now, I'm not recommending you drink that much, especially if you're sensitive to caffeine, but it tells us that there's a dose-response relationship. More green tea, within reason, equals greater blood pressure benefit. The mechanism is fascinating. Green tea contains compounds called catechins, and the most powerful one is epigallocatechin galat, or EGCG. This compound activates special potassium channels in the smooth muscle cells that line your blood vessels. When these channels open, the muscle cells relax, the vessels dilate, and blood pressure drops. It's the same basic mechanism that some blood pressure medications use, but gentler, more natural, and with additional health benefits. Green tea also improves something called endothelial function. Your endothelium is the inner lining of your blood vessels, and when it's healthy, it produces nitric oxide, a molecule that keeps vessels flexible and responsive. High blood pressure damages the endothelium over time. Green tea helps protect and repair it. But here's the critical part about preparation. If you steep green tea in boiling water, you destroy some of the beneficial compounds. If you steep it for too short a time, you don't extract enough of them. The optimal temperature is between 160 and 180 degrees Celsius. The optimal steeping time is 3 to 5 minutes. And the optimal timing for blood pressure benefits is first thing in the morning, before your blood pressure starts its natural daytime rise. 1 cup in the morning is a good start. 2 cups, if you tolerate caffeine well, is even better. But consistency is what matters most. Daily consumption, same time, same preparation, that's how you get results. Now, green tea is excellent, but it's not the strongest drink on our list. Not even close. Let me tell you about Margaret next, because her story is going to introduce you to drink number 2, and this one is so powerful that some studies have shown it working in as little as 2 to 3 hours after consumption. Margaret was 68, diabetic, and struggling with blood pressure that was consistently around 150/92. She was on 2 medications, but her doctor was considering adding a third. Margaret was worried about side effects, more pills, more potential problems. She asked if there was anything natural she could try alongside her medications. I told her about drink number 2. She was skeptical. It sounded too simple, but she agreed to try it for 1 month. Every morning before breakfast, she drank 8 ounces of this particular beverage. Just 8 ounces. That's 1 cup. Nothing else changed. Same medications, same diet, same exercise routine. 4 weeks later, her morning blood pressure readings were averaging 138/84. 12 points down on systolic, 8 points down on diastolic. Her doctor was shocked. Her medication dosages stayed the same, but now they were actually controlling her blood pressure effectively. What was Margaret drinking? Hibiscus tea, also called sour tea or roselle tea, a deep red tart beverage made from the dried petals of the Hibiscus sabdarifa plant. And the research on this drink for blood pressure is nothing short of remarkable. A clinical trial published in 2019 looked at patients with stage 1 hypertension. These were people with blood pressure readings between 130/80 and 139/89. One group drank 2 cups of hibiscus tea daily. The control group made lifestyle changes but didn't drink the tea. After just 1 month, the hibiscus tea group had significantly lower blood pressure. Systolic dropped by an average of 7.43 millimeters, diastolic by 6.70 millimeters. But that's just one study. There are dozens more. A comprehensive review of multiple clinical trials concluded that hibiscus tea consumption consistently reduces both systolic and diastolic blood pressure. The effects are dose-dependent, meaning more tea equals greater benefit, and they're sustained over time. This isn't a temporary effect that disappears after a few days. As long as you keep drinking the tea, the benefits continue. The mechanism is complex and, actually more sophisticated than many blood pressure medications. Hibiscus contains compounds called anthocyanins. the same antioxidants that give berries their color. These anthocyanins have several effects. First, they act as natural ACE inhibitors. ACE, or angiotensin-converting enzyme, is a substance in your body that causes blood vessels to constrict. Many blood pressure medications work by blocking ACE. Hibiscus does something similar, naturally. Second, hibiscus promotes the release of nitric oxide from the lining of your blood vessels. Nitric oxide is a potent vasodilator. It signals smooth muscle cells in vessel walls to relax. Vessels widen, resistance drops, blood pressure falls. Third, hibiscus has a mild diuretic effect. It helps your kidneys excrete slightly more sodium and water, which reduces blood volume and, consequently, pressure. The beauty of hibiscus tea is that it's working through multiple pathways simultaneously. It's not just doing one thing, it's addressing blood pressure from several angles at once. And that's probably why the research shows such consistent, reliable results. But preparation matters here too. To get the full benefit, you need to use actual dried hibiscus flowers or high-quality tea bags. Steep them in boiling water for at least 5 minutes. Some studies used steeping times of 10 minutes or longer. You want that deep, rich red color and tart flavor. That tartness is the anthocyanins. If your tea tastes mild and pleasant, it's probably too weak. The dose that's been studied most extensively is about 1.25 grams of dried hibiscus per cup, 2 cups per day. That's roughly 1 standard tea bag per cup. Drink it in the morning before breakfast, and if you're having 2 cups, drink the second one in the evening before dinner. One important note. Hibiscus tea is tart, almost sour. Some people add honey or a natural sweetener. That's fine, but don't add sugar. Sugar will spike your blood glucose and potentially negate some of the cardiovascular benefits. Hibiscus tea is powerful. It's evidence-based, and for many people, it's the most effective natural blood pressure strategy they'll ever use. But it's still not number 1 on our list, because drink number 1 is so potent, so well-researched, and so effective that some clinical trials have shown it reducing blood pressure by more than 10 millimeters within hours of consumption. Before I reveal drink number 1, I need to tell you about something that almost no one discusses. And this is critical if you're going to use any of these drinks safely and effectively, especially if you're already on blood pressure medication. These drinks are not replacements for medication. I need to be absolutely clear about that. If your doctor has prescribed blood pressure medication, you take it. These drinks are complementary strategies. They enhance what your medication is doing. They provide additional cardiovascular protection. And in some cases, over time, with your doctor's supervision, they might allow you to reduce your medication dose. But you never, ever stop or reduce medication on your own. You monitor your blood pressure carefully. You keep detailed logs. You share those logs with your doctor. And you let your doctor make decisions about medication adjustments based on actual data. That said, let me tell you about Robert, because his story is going to show you the incredible power of drink number 1. And it's going to illustrate why understanding the science behind it changes everything. Robert was 74, a retired engineer with high blood pressure that had been difficult to control for years. His readings were consistently around 155/95, even on 3 different medications. His cardiologist was frustrated. They'd tried different drug combinations, different doses. Nothing seemed to work well enough. Robert read about drink number 1 in a health magazine. He brought the article to his doctor. His doctor, to her credit, was familiar with the research. She said, "Let's try it, but we're going to monitor you closely." Robert started drinking 8 ounces of this beverage every morning, just 8 ounces before breakfast, same time every day. He continued all his medications exactly as prescribed. Within 1 week, his blood pressure was dropping, 145/88. Another week, 138/84. By the end of the 4th week, he was consistently reading 132/80. His doctor couldn't believe it. 23 points down on systolic, 15 points down on diastolic. Same medications. The only change was the morning drink. What was Robert drinking? Beetroot juice. Plain, pure beetroot juice. Not a beetroot smoothie with other ingredients. Not a beetroot supplement. Just the juice from beets. And the science behind why this works is one of the most fascinating stories in cardiovascular research. Let me explain the mechanism because once you understand this, you'll never think about vegetables the same way again. Beetroot is naturally very high in something called dietary nitrate, not to be confused with the nitrates added to processed meats, which are different and potentially harmful. Dietary nitrate from vegetables is beneficial. When you drink beetroot juice, that nitrate goes into your digestive system. Bacteria in your mouth, specifically on your tongue, convert some of that nitrate into nitrite. You swallow the nitrite. In your stomach and bloodstream, the nitrite gets converted into nitric oxide. And nitric oxide is probably the most important molecule for blood vessel health that exists in your body. Nitric oxide signals the smooth muscle cells in your blood vessel walls to relax. The vessels dilate. Blood flows more easily. Your heart doesn't have to work as hard. Pressure drops. But here's what makes beetroot juice so special compared to other nitrate sources. Beets don't just provide nitrate. They also contain compounds called betalains, which are powerful antioxidants, and other phytonutrients that seem to enhance the conversion of nitrate to nitric oxide. The whole package works synergistically. The research on beetroot juice is extensive. A systematic review published in 2018 analyzed 11 randomized controlled trials involving over 300 participants. The conclusion was unequivocal. Beetroot juice supplementation significantly reduces blood pressure. Some studies showed drops of more than 10 millimeters in systolic pressure, and the effects begin within 2 to 3 hours and can last up to 24 hours. One particularly impressive study gave participants 250 milliliters of beetroot juice, about 8 ounces. Blood pressure started dropping after 2.5 hours. Systolic pressure fell by an average of 10.4 millimeters. Diastolic by 8.1 millimeters. Those are numbers you'd expect from medication, not from a vegetable juice. Another study looked at patients with hypertension who were already on medication but still had high blood pressure. Just like Robert, they added beetroot juice to their routine. After 4 weeks, their blood pressure dropped by an average of 7.7 millimeters systolic and 5.2 millimeters diastolic. That additional benefit made the difference between poorly controlled and well-controlled hypertension. Now I know what you're thinking. Beetroot juice tastes earthy. Some people don't like it, but here's the thing. You're not drinking it for pleasure. You're drinking it as medicine, natural, evidence-based medicine. And honestly, most people get used to the taste after a few days. Some even start to enjoy it. The dose matters. The studies that showed the strongest effects used between 250 and 500 milliliters, which is roughly 8 to 16 ounces. Most people start with 8 ounces. If you tolerate it well and want stronger effects, you can increase to 12 or even 16 ounces. But you should do that gradually and monitor your blood pressure carefully. Preparation also matters. Fresh pressed beetroot juice is ideal, but it's not always practical. Many health food stores and some grocery stores sell bottled beetroot juice. That's fine, but you need to read the label carefully. It should be 100% beet juice, no added sugar, no added ingredients. Some brands add apple juice or other things to improve the taste. That dilutes the nitrate content and reduces effectiveness. You can also make your own. Buy fresh beets, peel them, chop them, and run them through a juicer. That gives you the purest, most potent juice possible. Store it in the refrigerator and use it within 48 hours for maximum freshness. Timing is crucial. Drink it in the morning, ideally 30 to 60 minutes before breakfast. This gives the nitrate time to start converting to nitrite and nitric oxide before your blood pressure begins its natural daytime rise. Some people drink it before exercise because it also improves blood flow to muscles. But for blood pressure control, morning consumption is optimal. One important consideration: beetroot juice will turn your urine and sometimes your stool a pinkish or reddish color. This is completely harmless. It's just the betalain pigments passing through your system. Don't be alarmed. It's normal. Another consideration: if you're on medications that are also nitrate-based, like nitroglycerin for angina, you should talk to your doctor before adding beetroot juice. The combination could potentially lower blood pressure too much. Your doctor might need to adjust your medication timing or dose. But for most people, beetroot juice is safe, well-tolerated, and remarkably effective. It's drink number 1 on this list because the research is strong, the mechanism is well understood, and the results are impressive. Now let's talk about something critical. How do you actually use these 3 drinks in real life? Can you drink all 3? Should you rotate them? What's the best strategy? Here's what I recommend based on the research and my clinical experience. If you're just starting out and you want to try one drink, start with beetroot juice. It has the fastest onset, the strongest immediate effect, and the most robust research. 8 ounces every morning for 4 weeks. Monitor your blood pressure carefully. Keep a log. See what happens. If you tolerate beetroot juice well and you're getting good results but you want additional support, add hibiscus tea. 1 cup in the evening, before dinner. The mechanisms are different enough that you're getting additive benefits, not redundant ones. If you're sensitive to the earthy taste of beetroot juice, or if you just want variety, you can alternate. Beetroot juice on Monday, Wednesday, Friday. Hibiscus tea on Tuesday, Thursday, Saturday. Green tea every day as your baseline, or you can use all 3 strategically. Green tea in the morning with breakfast. Beetroot juice mid-morning. Hibiscus tea in the evening. That gives you continuous blood pressure support throughout the day through 3 different biological mechanisms. But here's what I want to emphasize. Consistency is more important than perfection. It's better to drink one of these beverages every single day than to drink all 3 sporadically. Pick one, commit to it, make it part of your routine. That's how you get results. Let me tell you about the mistakes people make with these drinks because avoiding these errors will save you time, money, and frustration. Mistake number 1 is expecting instant results without consistency. These aren't magic bullets. Yes, beetroot juice can start working within hours, but the real benefits, the sustained, reliable blood pressure control that comes from daily consumption over weeks. Don't drink beetroot juice for 3 days, see no change, and give up. Give it at least 2 to 4 weeks. Mistake number 2 is using low-quality products. Store-brand green tea that's been sitting on the shelf for months has degraded catechins. Beetroot juice that's been pasteurized at high temperatures has reduced nitrate content. Hibiscus tea that's mostly filler and artificial flavor won't do anything. Quality matters. Invest in good products. Mistake number 3 is not adjusting your diet and lifestyle. These drinks are powerful, but they're not miracle workers. If you're eating fast food every day, not exercising, smoking, and drinking heavily, no amount of green tea or beetroot juice is going to fix your blood pressure. These drinks work best as part of a healthy lifestyle. Mistake number 4 is not monitoring your blood pressure properly. If you're going to use these drinks, especially if you're on medication, you need to know what's happening with your blood pressure. Get a good home monitor. Take readings at consistent times. Keep a log. Share the data with your doctor. This isn't optional. It's essential. Mistake number 5 is not communicating with your doctor. Your doctor needs to know what you're doing. These drinks are safe for most people, but there can be interactions or considerations specific to your situation. Be open. Be honest. Work with your healthcare team. Before I finish, I want to give you the complete protocol. This is exactly what I would recommend to a family member with high blood pressure who wanted to use these drinks strategically. Week 1. Start with 8 ounces of beetroot juice every morning, 30 minutes before breakfast. Monitor your blood pressure twice daily. Morning before breakfast, evening before dinner. Log every reading. Week 2 to 4. Continue the beetroot juice. Add 1 cup of green tea with breakfast. Continue monitoring. Look for trends. Are your numbers dropping? Staying stable? Any symptoms like dizziness or fatigue that might indicate your pressure is dropping too much? Week 5 and onward. If you're getting good results and you want to enhance them further, add 1 cup of hibiscus tea in the evening. Continue the beetroot juice and green tea. Keep monitoring. Share your log with your doctor at your next appointment. If you're getting excellent results with just 1 or 2 of these drinks, don't feel like you have to use all 3. More isn't always better. Find what works for you and stick with it. And remember, these drinks are tools. They're part of a comprehensive approach to cardiovascular health that includes medication if prescribed, diet, exercise, stress management, adequate sleep, and regular medical monitoring. They're not a substitute for any of that. They're an addition, a natural strategy that complements everything else you're doing. Before we finish, I need to tell you one more story because this one brings everything together. Her name was Dorothy. She was 76. She'd been on blood pressure medication for 15 years. 3 different drugs. Her pressure was controlled, but she was tired all the time, dealing with side effects, feeling like the medications were aging her. She came to me asking if there was anything natural she could try. I told her about these 3 drinks. She started with beetroot juice, added green tea a few weeks later, then hibiscus tea in the evening. After 3 months, her blood pressure logs were remarkable. Consistent readings around 125/78, better than they'd been in years. Her primary care doctor, working closely with me, slowly reduced one of her medications. Then, over several more months, reduced another. Dorothy is now on one low-dose medication instead of 3, plus her daily drinks, and her blood pressure is better controlled than it's ever been. She has energy again. She feels like herself. I'm not saying this will happen for everyone. Everyone's situation is different, but it shows what's possible when you combine evidence-based natural strategies with good medical care. Now you know the 3 drinks: green tea for endothelial support and gentle, consistent blood pressure reduction, hibiscus tea for powerful multi-pathway effects through ACE inhibition and nitric oxide enhancement, and beetroot juice, the most potent of all, for rapid, significant blood pressure reduction through the nitrite-nitric oxide pathway. You have the science, you have the protocols, you have the practical guidance. What you do with this information is up to you. If what you learned today was valuable, I need you to share this video. Think about your family members, your friends, anyone you know who's dealing with high blood pressure. This information could change their life. And subscribe to this channel if you haven't already. My mission is to bring you cutting-edge, evidence-based health information in a way that's clear and actionable. Information that empowers you to take control of your health with confidence. Take care of your heart, take care of your vessels, and I'll see you in the next video.